revision rhinoplasty. It's more difficult than a primary rhinoplasty. Love to see you. Favorite surgeries to do, and I've done tons of them and I feel very comfortable with them. All right, welcome back everyone. My name is Dr. Sean. I'm a Beverly Hills plastic surgeon. And for today's topic, I wanted to tell you a little bit about revision rhinoplasties. So if you're watching this video, I'm gonna assume that you know what a rhinoplasty is. It's a fancy name for a nose job. But what does it mean when I say a revision rhinoplasty? Well, it's exactly what it sounds like. It means that it's not the first time somebody has had their nose done, and it can usually be the second, third, and sometimes even fourth or fifth time that they're having the rhinoplasty done, usually because there was something incomplete or something incorrectly done in the initial operation. So usually it requires a revision in order to get the nose to the place where you want it to be and correct any potential deformities that may have been caused from the initial rhinoplasty. One thing to know about revision rhinoplasty is that it is significantly more difficult than a primary rhinoplasty. Why is that? Because like I said, it's been operated on before. So obviously there are going to be the factors where you're not 100% sure what the other surgeon had done inside the nose. And even if you do get the operative record, a lot of times there will be some surprises in there. But the other thing is that because it's been operated on before, that means that there's scar tissue. Because anytime you make a cut and do surgery on somebody, there's always going to be scar tissue formation. And then every time you reopen an area, especially in the nose, you're going to have more and more scar tissue that kind of obscures the anatomy to some extent. And therefore it requires a surgeon who has a really good understanding of what nasal anatomy should be, to the point where even if the anatomy is not really recognizable, the surgeon is able to decipher it and recreate the nose with a good structure in order to give you the result that you want. So usually for a revision rhinoplasty, I will almost always do them open, which means that I will open up the nose completely, and that usually entails a small scar across the columella, which is this lower part of the nose. The scar is basically invisible because the face heals so well. But a lot of times the one thing to really know about a revision rhinoplasty is that typically for a primary rhinoplasty, I'll rely on the septum, which is essentially the structure that sits right in the midline and gives your nose that structural support. I'll rely on the cartilage from the back of the septum in order to reconstruct parts of the nose in a primary rhinoplasty. But in a revision rhinoplasty, a lot of times that septum has already been removed by the initial operation. So if I want to use cartilage, I have to rely on other sources. What do I mean by other sources? Well, usually it will either mean that I go and take cartilage from one of the ribs, and this only works in people who are usually under the age of 50, because as we get older, our ribs begin to calcify, meaning that they become more calcium deposited rather than having cartilage, and that's not very good for the nose because you can't sew through it, it doesn't work right. So if you are older or don't want to go through the operation with having your own rib taken, I do also sometimes use something called cadaveric rib cartilage, which is actually rib from a cadaver that's fully sterilized and acellular. But what this does is it basically acts as a scaffolding where your body will actually integrate that rib into your own tissue and then remodel it with your own cells. So this gives you a good option of having to avoid any of that painful rib harvest or that scar that you might have on the chest if I were to go after your own rib. The other important things to know is that with a revision rhinoplasty, afterwards you can expect more swelling than before, again because of that scar tissue, so the swelling will take longer to come down. And also you do have a higher risk for bruising as well as potential contour irregularities, again because since it's been operated on before, that just creates a level of complexity in the healing process that isn't there in a primary rhinoplasty. So if you are interested in having a revision rhinoplasty done or want to discuss your options, I would love to see you, because rhinoplasties are one of my favorite surgeries to do, and I've done tons of them and I feel very comfortable with them. So if this interests you, go ahead and contact my office, and I'll see you guys next time.
Every shade, every hue, one sense of beauty.